That, yes,
yeah,
yes.
I think I've heard
yeah, but you know, you can see in the net a lot of things which may not.
So are UTIs sexually transmittable?
Those who have, those who are involved, if you look at the risk factors, those who are sexually active tend to have it more. Okay. Those who use spermicidal, like this form of contraception that kills the sperms and all that, tend to have it more. Women who are premenopausal tend to have it more than women. And it's in their late, yeah. And then it's also commoner in females compared to males and all that. So yes, sexual intercourse can increase your risk as a risk factor.
Wow. So most times we are told that UTIs are recurrent. I don't know, there was this time I read about it and we are told that it's recurrent mostly after every 3 months. How true is this?
Wow, that's a tough one. I have not come across that. But the truth is that recurrence is there, and there are factors that can cause it to recur. Okay. Like one of them is that if you have an outlet problem, let's say for some reason the urine doesn't go out, all of it, so it becomes a medium for bacteria to grow. So those people tend to have UTI a lot. A pregnant woman, because of the progesterone, peristaltic movement are low, the abdomen is distended and all that, so they tend to have stasis. So those people who tend to have recurrent UTI. If you have diabetes, you know, your urine has a lot of sugar and, you know, you have suppressed immunology and all that, so you may also have recurrent UTI. So some people with like HIV or immunodeficiencies and all that tend to have recurrent UTI and all that, yeah. And some of people involved in certain practices, like they put something in their area, the like foreign bodies.
Is it dodging? I don't know how to
like even, let me use the medical term. Sometimes we use catheter to put it in women. You know, for some reason, there are some women, they need catheter all the time so that they empty their urine. Those people will tend to have more UTI. So there are some factors that will increase their chances of having recurrence.
So does it cause infertility? Are women that are prone to UTIs also prone to infertility?
That's what I'm saying, that UTI and the reproductive system, they are a bit linked, but quite they're a bit different. Because you see, they all open in the vestibule, the vagina, the meatus of the urethra, they are all the vestibule and all, but it's different. Okay. Yeah, so the urinary tract is up, then you have the vagina. Just they share the same wall and everything. And yes, some infections that affect the uterus and all that can start from the bladder and then move to there if it is not treated well. Okay. But generally, I will not say UTI will cause infertility, but you know, you can say never. Because you can have a very serious infection from the bladder that later moves into the uterus and then maybe later causes problem for the woman. Because if you have infection now in the uterus or the cervix or the tubes, that can cause infertility.
So Dr. Bittaye, some of the questions that I'm asking you now actually are involved, because before we had this session, I posted on our social media pages to have our followers post questions they might want me to ask you today. And most of them complained of using more of vaginal insertion pills, and they are told that if they use that so many times, the drug might not work again for some reasons, because their systems are so used to using it. I don't know, maybe I'm not putting it in the right format, but I don't know if you understand exactly what I'm trying to say. Is using like drugs, overusing drugs, will it cause the drug not to be effective for its particular purpose anymore?
I think that's it. So antibiotic misuse is a very important topic in the medical field. And we are scared because, you see, we are having resistance all the time. That's why I'm telling you that we are not blind in the treatment. So we take it for culture, then we get the bacteria, then we test the antibiotics that are coming to kill that bacteria. But what we are realizing is that those bacteria now, they are like big cyborgs. So most of these bacteria cannot kill, most of these antibiotics cannot kill them. And to get one new antibiotics is not easy. It's a lot of research, years and years of research.
Oh my God.
So now, if we exhaust all our antibiotics, you know, we will have some bacteria that will develop that none of these, we call them multi-drug resistant bacteria.
Okay.
So maybe all these antibiotics cannot do anything to them.
So are they the one, is it this, the persistence of these bacteria that cause the reoccurrence?
Sometimes, yes. So you can have treatment failure. Some of these bacteria, you give the antibiotics and it cannot do anything to it.
Maybe it goes off for some days and it comes back.
Yeah, that's treatment failure. That's different from reinfection.
Okay.
Yeah, you have an infection, but we couldn't treat it properly because the drugs we have are not good enough.
Okay.
Yeah, and so antibiotic misuse can lead to resistance. If they give you drugs that you're supposed to take for 1 week, you take it for a day, you get better, you stop. So you've not finished the whole, and the bacteria already get sensitized. So the bacteria, they are getting wiser, they produce some things, and yes, and so that antibiotic may not be able to kill them again. So, and what is bad is that that bacteria now transfers to someone else with already that protection. Yeah. So that's why we try to always, people don't self-medicate. Don't just go to the pharmacy, buy a drug and take. You know, you cause this resistance, and this resistance is going to affect the country in the long run. That's why you see we change. Initially, we were using chloroquine for malaria, for example.
Okay.
Now we are using artemisinin-based drugs. Next, so because chloroquine cannot treat again, yeah, so with resistance. So now we have to go to a more expensive drug, and this is going to affect the country. Now the health budget, instead of buying a cheap drug to treat malaria, now we take a lot of money, and so because of that, you will not have other services also. So in the long run, the biggest danger in the long run is that if we continue that practice, there will come a time when we have not created new antibiotics, because it's difficult to create antibiotics or to get new antibiotics. And then we have drugs, we have germs that you know that no antibiotic that is available can kill them. Can kill them. So right now we have some patients that, you know, sometimes all the antibiotics we have here cannot do anything for them, so they have to order drugs from Ghana, you know. Yeah, they get drugs from Ghana. It's very expensive, and you come and use it. So if you misuse the drugs, that's what happens. So people should not self-medicate. You don't just go and buy medicine and start using it. Yeah. And when they give you your medicine, you have to finish it. Don't say, oh, I feel much better, so I will not.
And that's the culture. That's the culture that most of us, including myself, I'm not going to. I drink medicine for some time, and when I'm okay, I'm like, I'm done with it. So like you've had, Dr. Bittaye is like, nobody should self-medicate. When you have problems like this, you visit a doctor to see a gynecologist. Is it only gynecologists that attend to problems like this?
No.
You have other doctors that can
I mean, almost any doctor should be able to take care, because the urinary tract is very important. It cuts across all areas.
Okay.
You know, women, children, adults, you know, everybody can have it. So basically, most doctors, any doctor, I think, will take care of urinary tract.
So how friendly is some of our hospitals when it comes to receiving certain girls like us when we have problems like this? Because some of the girls mention that they run away because of privacy issues. So how private is our medical facilities to make sure that we encourage our girls out there to see a doctor when they have problems like this?
So that's an important question.
Very important.
So the truth is that part of our training and the role of the government is to ensure that any woman, so it's not any woman, any patient, but you know, you have to understand my background. Sure. Yeah. My background is I'm a gynecologist. True. So when I talk, I always say woman. True, but I mean all other people. So any patient who comes to the hospital needs to be dignified. Okay. Yeah. So you need to be given privacy. You need to be talked to in a dignified way. And you know, all your concerns would be, this is what is expected. Yeah. And I think we should do well on that. But you know, sometimes, you know, I mean, that's a basic minimum. Privacy. You know, no, that's a basic minimum. So I don't think that you will go to a hospital where a woman will just be examined anywhere.
Well, anything can happen, Dr. Bittaye.
No. I'm saying
that can happen.
No, the problem is I'm involved in training doctors, and I'm in the hospital, and I know the way they think, and also I can't see that happening. Oh, yeah. Like a person be examined anywhere, like without giving you privacy. I don't think it will. Although most women will not want to come to our hospital because you know, these young women, they want nice place, you know, with AC,
and everything,
you know, everything so shiny and all that. So that if you're looking for that in the government hospital, that would be difficult. Yeah, but if you go to the privates, there are those things. But I think the government will reach that level too. We have to try. You know, we have to try to reach that level. Yeah. But these young women, that's what they look for. You know, the glamour and all that. but the privacy, the basic things, the dignity we are going to give them and all that, those ones I think should be standard. It's minimal. If anyone is not giving you that, you have the right to say no. Yeah. As a gynecologist, I cannot examine another lady without having a chaperone. Oh, yes. I always have another lady.
Okay, another lady in there to make sure that...
To make sure everything is fine. Because if you don't, sometimes there is lack of another nurse to help you, so you get another patient or another escort to come and join you. But these are basic things that should happen.
So it's really a problem if only a male gynecologist and a woman is examining a woman?
Yes, a big problem.
It's a very big problem.
Big issue.
Oh my God. I never knew that.
Yeah,
I thought like it's just okay because, you're a doctor, so it does not really matter.
No, some people don't want another person there. Like some of these patients, like if you want another person, they say no, but you have to explain to them and they understand, because it's for the safety of the doctor.
That's true.
And for everyone. Because if something happens, let's say in very conscious places, you examine a lady alone with her, she can come out and say, you did this to me.
That's true.
And if she does that, the courts, the honor is on the doctor to prove. Why? They will say, you have a motive. Why will you go and examine somebody without, and in your teaching you are taught that somebody should be there. So why will you do not do that? So that means what the woman is saying probably is true. And even though it may not be true. So it's also good for the patient because it means that you have somebody there who can help you and all that.
And that's final question, Dr. Bittaye. I want to understand more when it comes to bloody urine and foul smell, discharge, and irritation, like itching, in the outside of in the private part of the woman when you're affected with UTIs. So are those symptoms only common to urinary tract infections, or it might be something else?
Yeah. So for vaginal discharge and abnormal bleeding and all that, that's a whole different area, and it's a big topic. I don't think you can. But for bloody urine, because the urethra for women is separate from the process of reproduction. But for men, the same urethra is where the sperm pass, is where the urine pass. So sometimes if you have STI, for example, in the man, you can have some discharges and all that. It's still through the urethra. But for the female, if you have a bloody urine, sometimes it could be from the infection. A bad infection that's not treated, UTI,
it's really serious.
Yes, can cause blood. But the most commonest one that you see blood in the urine is either the woman has a stone inside.
Inside?
Your bladder. Sometimes, sometimes like bladder stone. You see a very nice stone when we remove it from operation. Crystal. So they can have stone, and the stone can cause irritation and all that, and then they can bleed. So the other thing that can cause that common, but that's usually in where you have upper river region and all that, where we call schistosomiasis. Yeah, where you have non-salty water. Where the kids go there and all that too. So you have what we call schistosomiasis. So schistosomiasis will cause bleeding, but that's painless. These boys, they just sit down and they have bleeding through it's fine. So it's easy to treat. You just give them some drugs and
it's gone. Okay, Dr. Bittaye, thank you so much for joining us on this episode. And I'm going to be having Dr. Bittaye again to talk about menstruation, what's normal and what's not normal. I know our girls out there have so many questions and they don't have a platform which can offer them or give them these answers. Thank you so much, Dr. Bittaye, for joining me on the episode of Girls Talk. Thank you so much, viewers, for watching. Make sure you like, subscribe, and also follow our Facebook page to have more updates on the show. Thank you so much. I'm Isatu.